Now this is Hello Magazine, and Hello Magazine looks at lifestyle and beauty trends and actually what would work for you and something that you might be interested in. So if you look at this particular article, this article looks at 6 trending aesthetic treatments that really work, 3 or 4 of which are energy-based devices, bar 1 anti-wrinkle and 1 which is my favorite treatment that I tend to do in my clinic, and it really delivers genuine results. So unlike skin boosters, which are mainly made of hyaluronic acid, Sunekos is completely different. So Sunekos contains hyaluronic acid, which is definitely essential, as well as 6 strategically concentrated and formulated amino acids. And this is the cocktail to really deliver results when targeting specific areas of the face or other areas of the body. So what exactly does it target? It targets collagen 1 and 3 production, it targets promoting elastin and also deep regeneration of the skin. So what you get here is natural rejuvenation of the skin and enhanced radiance. So mainly in my clinic, I tend to use it for under eyes. It's fantastic for under eye crepiness as well as under eye darkness. But I've just got to really put a point here that not all under eye darkness can be treated, because this is called constitutional darkness. Some of the darkness tend to be genetic, some of the darkness tend to be due to thinness of the skin. It could be excessive pigmentation. There are lots of reasons why you may end up with under eye darkness. However, what I found that Sunekos does is it really promotes hydration, it works on the crepiness of the skin, and it brightens up that area. And I've had incredible results with Sunekos under the eyes. But in addition to that, it really treats the full face. So wherever you have skin, Sunekos can treat it. So I tend to use it for under the eyes as well as the nasolabials as well as the other parts of the face. But what's more, it's fantastic for neck crepiness and neck rejuvenation. And we all know that there are 2 areas which Sunekos does actually treat, the back of the hands and the neck, and these are the 2 areas, guys, that tend to be the telltale signs of aging. So you could do everything on your face to rejuvenate it. However, if you ignore your neck and if you ignore the back of your hands, then this is the telltale signs of aging, and thankfully Sunekos can treat both of them. So if you look at one of my patients here, she's been treated with Sunekos. We start off always with a mild exfoliation or a treatment that's bespoke to her skin. And so I always tend to sort of have the motto of treating the skin inside out or outside in, whichever way that I feel at a particular time that's needed. So prior to that, there's an element of mild exfoliation to really bring out the radiance of the skin. I then move on to do the Sunekos. So there are 2 vials of Sunekos. You've got the Sunekos 1200, which is a high concentration of hyaluronic acid, and there's also the Sunekos Performer, which is a medium strength of hyaluronic acid. These 2 in combination work beautifully. So what I tend to do is initiate the treatment with the 1200 to create a cushioning layer, and then I move on to work on to the restoration using the Sunekos Performer. So in this particular case, I would be using the product around the eyes, as you can see, and I even approach the eyelids, as well as using it around the cheek area and nasolabials as well, and really work even with a cannula. And this is very beautiful product to be able to evenly spread it to the target area. It's not a filler, so I just got to be absolutely clear on this. It's not a filler, it's actually a skin regenerator. Now, how many treatments do you use? This is a regenerator, this is not dermal filler. So in that particular case, you've got to really think about your skin being a journey and it's regenerating. So you've got to work in synchrony with your skin. So how long does it take? Well, it will be on average of 3 to 4 sessions, primarily 4 sessions, about 10 to 12 days apart, and that's a course of 4. So this is what, and then thereafter you tend to have a maintenance of maybe every 3 or 6 months of 1 session. Does it hurt? And this is a golden question that I always get asked, and I can never give you an absolute answer. What does it all mean? Does it hurt? Pain is really subjective. Some people really feel the pain quite badly, otherwise others are absolutely fine. So does it hurt? Well, there's a level of discomfort. I am not going to kid you here. There is a level of discomfort, but the beauty of a skilled practitioner is that they are able to work at speed after an in-depth consultation. And I keep saying this again and again, the most time that I spent in my treatment session is actually the consultation. Once I know that you are the right patient for the right treatment, then the treatment itself is not that complicated. Do I use a numbing cream? Ideally, I do not like to use numbing creams for many reasons, and one of which people can be allergic to the numbing cream itself, and numbing cream can actually cause a vasoconstrictive effect. It doesn't bleed and then it bleeds, and I've seen a lot of people after a numbing cream may actually bruise. So from that perspective, I don't like to use a numbing cream. The question is, are there any side effects? The biggest side effect, then the most common one that I would say to you, is bruising. And I would say to you, I will do my best not to bruise you, but I can't guarantee it because the face is a meshwork of blood vessels. But I do my best not to bruise you. But I also would ask you not to take certain medication or supplements prior to your treatment because I do not want you to be bruised. What will my skin look like during the treatment? Well, you're going to have an element of inflammation. Of course, you've had needles and cannulas going to your face, so yes, that's absolutely fair to say that there will be a slight inflammation or slight redness after your treatment. However, what you do see where I've injected those tiny little aliquots, you will see those tiny little aliquots underneath your eyes, and then they will dissipate after sort of 6 to 24 hours. A lot of people tend to come to me during the evening because I do run an evening clinic, and it works really well where I'm situated because a lot of people tend to finish work and then they come to me, especially during Thursday, Fridays or the weekend, because it suits their lifestyle. Also, others who are in hybrid roles and they have a day off or a day of working from home, they tend to come in that evening as well, because then that gives them that chance to recover whilst they're at home. What would I ask you to do? I would ask you to really strictly and diligently follow the aftercare instructions, because bad aftercare adherence it will spoil the treatments. Who do I not treat? Well, I will not be treating you if you have an active skin infection such as cold sores. I will not be treating you if you have any dermatitis, psoriasis, eczema, perioral dermatitis. I will not be treating you. Also, if you have skin cancer or active skin cancer, I will not be treating you. I will need to actually then have a little bit more discussion as to when the cancer has been resolved and where you're at in terms of that journey post-cancer. So that's also very important. In terms of pregnancy and breastfeeding, I'm sorry guys, I won't be able to treat. It's contraindicated for pregnancy and breastfeeding, and I will not be treating if you're allergic to the excipients of the product itself. So there are reasons why I would not be treating you. How will your skin feel and what will it look like and what will you notice? Well, here's the important thing. So the first thing you will notice is immediate hydration, because hydration is as a result of the injection of hyaluronic acid into your skin. Now with the skin journey, this is how it will look like to you. You will first get a sensorial experience, so it is how you feel. So this is where you're starting to begin to see what's going on. Then you will see noticeable result, and this is mostly noticeable to you or those with an acute eye to say, you've done something different and you're looking a bit, it's like something about you that I can't quite figure out. Then you will see the visible difference, and the visible difference is when other people can see it too, and they'll say, you look really fresh, you look really well, have you been on holiday? This is the type of reaction that you would want to get. You don't want to get something that will say you've been done. And Sunekos is not that type of treatment that will produce a comment that you have been done. But I'm really happy to see that it's actually made it into the top 6 of aesthetic treatments that produce real results. So if you want to know more about this treatment, or if you've had this treatment yourself, please let me know, and I'll be more than happy to give you more information, and we can take it from there. Keep glowing and stay amazing.